The next part of the exam is the eye exam. And with all exams, of course, you're going to start with inspection. With inspection of the eye, you look first top to bottom. Start with the eyebrows, eyelids. Look where the lacrimal glands are. Look at the sclera and conjunctiva and the pupils. And always, of course, comparing one eye to the other. Now, the next part of this is I want you to look up towards the ceiling, and I'm going to just pull down the lids here. I'm looking at the lower part of the lids. All right, good. And again, comparing sides there. The next part is visual acuity, when I'm going to assess Frank's vision. Now, in your clinical practice, you'll often see your preceptors checking with an eye chart that's 20 feet away. I'm checking near vision, and that'll be about 14 inches away. And for anybody who needs reading glasses, they should put those reading glasses on. So Frank, you can put your reading glasses on, because with near vision, he will not be able to see if he needs reading glasses. Now, Frank, can you hold this about 14 inches away? Now cover up your left eye, because I'm going to be checking one eye at a time. And with Frank, with your right eye exposed, look at the lowest line of numbers that you can read there along the left side of the chart.
937-826.
All right, and so when I look at that, that is 20/25 vision with the right eye. Now if you can cover your right eye, now I'll do the same thing with the left eye and check your vision again on the left eye.
937-826.
All right, and same thing, so 20/25 vision on both sides. And what I'll do now is assess visual fields. Now you think about the visual fields as in 4 separate quadrants. There's a upper quadrant, temporal quadrant, lower temporal quadrant, upper nasal, and lower nasal quadrant. That's for each eye. So I'm going to check each of those quadrants. I'm going to use fingers. I'm going to ask Frank to tell me whether he's seeing 1, 2, or 5 fingers. I'm using those numbers of fingers because it's easy to distinguish 1 and 2 and 5 from other digits. So Frank, if you can cover your left eye with your left hand, and what I'm going to do while he's doing that is I'm covering my right eye so that I can check my field of vision against his as a standard. Now you look at my nose and then tell me how many fingers you see me holding up. And
1.
Yes, and just watch my nose if you can. Okay, now tell me how many fingers?
2.
All right, and how many fingers here?
5.
And you see that I'm holding it in a way that he's able to see how many fingers. I'm not going to turn my hand in different directions where numbers of fingers can be confused. Now we'll check the same thing with the other. Keep your hand there. And how many fingers do you see here?
2.
And how many fingers here?
2.
All right, now you saw that he didn't see the right number of fingers in the upper outer quadrant, so I'm going to check that again. Now tell me again how many fingers you're seeing here.
2.
All right, so I've checked all 4 quadrants of the right eye. Now you can replace that hand and now cover up your right eye. Now we'll check the left eye. We'll do the same thing, starting first with the upper and lower outer quadrants and then switching to the inner higher and lower quadrants. All right, so again, tell me how many fingers?
5.
And how many fingers?
1.
All right, and here?
2.
And here?
1.
All right, good. So he's checked all those quadrants on both sides. Now the next part of the check here is to check for the near response. I want to see that as Frank looks in the distance and then brings his eyes in and looking towards me, his eyes converge a little, come in closer together, and there's a little bit of pupillary restriction, but I may not be able to see that. Now Frank, if you can look at the wall over there, okay. And now look at my finger here. And what I see is that his eyes converge and come together. I see a little bit of pupillary restriction. Now I'll move right into checking extraocular motions. Just watch my finger here. And I'm going to move this in an H pattern. Out this way and up this way. I'm watching both eyes, making sure that they're both moving in conjunction with each other, and out this way. Up the H pattern up to the top and then down to the bottom. Okay, and then back to the center. So that checks all the extraocular motions of many of the different eye muscles. And the next part that I'm going to check is watch for pupils to see that they react to light. Now typically for checking pupils, you want to turn off the light. I'm going to leave the light on so you can see what it is that I'm doing. But as you're examining patients' eyes, especially the pupils, or looking at the retina, you would turn the light off. So I'm going to bring over the ophthalmoscope, and I'm going to show you a few aspects of this ophthalmoscope so you can see what are the characteristics here. First, this is the back of the ophthalmoscope. This top part, you would rest right on your forehead. And this is what you would look through, this aperture here. And right down on the bottom are a set of numbers. And that number you should always have set at 0. This dial on the side is how you would turn that number away from 0, but you're going to keep it always on 0 here. Now I'll turn the ophthalmoscope around the other way. This is the patient side to show you some of what you see here. There's one dial here that'll control the light characteristics. And then there's another dial here that controls how bright the light is. So I'll show you how that works. I'll use Frank's gown here. First, the brightness. This is this dial here. As you watch that light, you see that it's getting brighter and dimmer as I'm moving this around. And when you're examining someone's eye, when you're looking in the back of their eye, you want to leave that light source about in the middle, not super bright, not dim. And then the other dial that I showed you for the source of the light, you can move that back and forth to see first a small amount of light, medium amount of light, large amount of light, and then you go to some other aspects that we don't use in PDS. One is a target, a slit light, and then a blue light. But what you want to use for the light source is about the medium size. So medium size light source, about medium intensity of light here. Now what I'm going to check first is Frank's pupillary response. And as I said, I would typically dim the lights here, but I'll keep them bright. So if you can look against the opposite wall here, what I'm doing is I'm shining the light in one eye here to see that the pupil is constricting. And while this pupil, the right pupil, is constricting, the other one should also be constricting. And then I'll go over and check the left pupil and see that the left pupil is constricting at the same time that the right pupil is constricting. That's normal for both pupils to constrict, even though light is shining just in one pupil. Now the other part of this is the swinging flashlight test, or checking to make sure that pupils stay constricted. So I shine on this eye, and then I move over here for a couple of seconds, and back over here. I'm looking at both pupils as I'm doing that to see that both pupils are staying constricted as I move the light back and forth, as a way to check that the eyes are both getting the same information from the optic nerve. Now the next part of this is also to check the optic disc. The main purpose of checking the optic disc is to be able to see the end of the optic nerve and to see the disc itself. The remainder of the retina is made up of blood vessels and the background of the retina. In PDS, it may be hard for you to identify the optic disc, and so what I want you to be able to do in your first year and into your second year is to be able to identify a blood vessel. And as you get more comfortable with evaluating blood vessels, then you want to be able to focus in and find the optic disc. So I'll show you how I would recommend that you do this. First, if I'm examining Frank's right eye first, I'm going to hold the ophthalmoscope in my right hand. I'm going to use my right eye, and my left hand will be to stabilize myself with my hand on Frank's forehead so that I can tell how far away I am from Frank's eye, because I need to get fairly close with this ophthalmoscope, and I need to have some sign to myself of where I am in space. So what I'll do first is I'll put my hand on your forehead, Frank, here, and I'm going to hold this over my right eye, and I'm looking at Frank's eye, and what I'm seeing here is a red reflex as I'm starting about this far away. I'm a little bit off center here, looking in Frank's eye, and then I'm going to come in closer here. And as I come in closer, I'm looking for a blood vessel. That's a red line across a palish or orangish field. And as I find one of those blood vessels, you see I focus in and I see it right about at this distance. So you can see about how far away I am for Frank's eye. That'll vary a little bit depending on your vision and the patient's vision as to how close you need to get. And then once I find the blood vessel, then I follow it, and I follow it to a yellowish disc, which is the optic disc. As I said, that's a more advanced skill. If you find a blood vessel right away, See if you can follow it to the center and see an optic disc. Now I'll move to the other eye. So what I'm going to do is I'm going to bring this behind the patient. I'm going to now hold this in my left hand. I'm going to look at Frank's left eye, and I'm using my left eye. And then I'll use my right hand to stabilize on his forehead. So I'll come in through this direction, again identifying the red reflex, and then coming in closer. I see blood vessels, and then I can move in again to the optic disc. And that concludes the eye exam today.